First at 5, hundreds of patients left without medications they need after their Kennebunk doctor was arrested on drug charges 3 weeks ago. Good evening. Thanks for joining us. I'm Greg Lagerquist.
And I'm Marissa Bodner. Tonight you'll hear from one of those patients who suffers from intense chronic pain, who says he got the help he needed from Dr. Merideth Norris. CBS 13's Brad Rogers joins us now live, and Brad, Norris is facing up to 20 years if convicted.
Yeah, Dr. Norris is accused of prescribing controlled substances, including opioids, outside the scope of her medical practice and without a legitimate medical purpose. But a handful of patients we've spoken to say Dr. Norris is the only one who got them the help they needed and even took steps to lower their dose of opioid medication.
My cervical spine is fused with plates and my lumbar spine is fused.
Ben McGregor was one of Dr. Merideth Norris's 426 patients being treated for either substance use disorder or, in his case, pain and anxiety management here at Graceful Recovery in Kennebunk, which opened in 2016. That's when CBS 13 spoke with Dr. Norris.
I don't start people on medications that they're not going to be able to afford.
As a result of her arrest by the New England Prescription Opioid Strike Force on federal drug charges, Dr. Norris can't write any prescriptions for medication, leaving patients without the meds they need.
I don't understand why I should have to suffer because some task force wants to make a point.
McGregor says a pain specialist referred him to Dr. Norris, and she recommended a reduction in the use of OxyContin. Now he says doctors won't even read the labs Dr. Norris ordered.
With what happened to her, I was left unable to have those labs read, as well as not be able to refill some medications she had prescribed. I am faced with having the carpet ripped out under my feet and will soon lose the ability to perform basic tasks like getting dressed. And I don't think that's necessary.
The state asked Sweetser, which isn't associated with Dr. Norris, to provide a crisis line and referrals for her patients. They report more than 250 calls so far. They're able to quickly help those with an opioid use disorder, but are finding it more difficult to help those who need pain management.
It is a lot harder to link patients to providers who are willing to give opiate medications and things like that for pain control.
The fear is patients may turn to opioids if they can't get the medication they need.
We are very concerned that patients may seek other ways to treat their pain.
It seems like she was arrested, but there was no plan for her patients.
I feel like there was no plans. The day or two after when I found out about it was when I learned those prescriptions were no longer valid. I was left with no recourse, no warning, and no medication.
We reached out to Dr. Norris, but did not hear back. Now, Maine DHHS says all but 61 of Dr. Norris's patients are now getting the treatment they need. Sweetser also says that the Federal Drug Enforcement Agency is providing some reassurance to doctors here that they can go ahead and prescribe opioid medications to those who need it. We're live in Portland. Brad Rogers, CBS 13 News. Back to you.
All right, Brad, live in Portland tonight.